Hello, ladies and gentlemen. My name is Gary Baumgarten, and I expect you already know that. And I want to welcome you, for those of you who are watching on Facebook, on paltalk.com, and on YouTube. Welcome to our latest discussion. Today, I'm pleased to have with me Dr. Anisha Patel-Dunn. Anisha Patel-Dunn. She is the Chief Medical Officer of LiveStance Health and a psychiatrist. And I'll tell you what, all of us, even those of us who are relatively stable, could probably use your help these days, because we're under so much stress as a result of what's going on with the COVID-19. And I think it gets worse and worse for a lot of people as it extends. And your company actually is in the forefront of telemedicine. Helping people over the internet, I guess, mainly deal with their stress, because we can't have those face-to-face meetings with our therapists any longer. And as I understand it, you were actually gearing up to expand your telemedicine activities when this hit, and then you had to just, put things in high gear. Yeah.
Yes, exactly. That's what happened for us. So we at LiveStance are approximately 2,000 clinicians across 15 states, and we predominantly were in our 200 offices seeing patients in person. And we're starting to, in some of our locations had started utilizing telepsychiatry and teletherapy, but really we're just starting to integrate that across all the practices. And we, within 2 weeks, got all of our 2,000 clinicians up and running on utilizing video conferencing for their appointments, converting everybody to video.
So what is happening actually? Are you finding that their practices are quite busy right now, actually?
Yes. We are actually, I myself included, and all the clinicians, we're very busy. We're seeing people, our existing patients who had struggled with anxiety or depression are wanting to come in more often. And then also new patients that are really, struggling, as all of us out there are really, feeling the gamut of emotions. And really, I think people that are not able to manage it, really wanting to reach out and get help.
So what are some of the things that we are seeing? I imagine one of the issues has to do with isolation, and another one of the issues, depending on the living conditions, have to do with getting in each other's faces a little bit too much.
Yes, exactly. Yeah, so we are seeing, real sadness, depression from the social isolation, especially people that are used to being quite extroverted and, managing if they had depression before or if they hadn't, but, managing with making sure they're getting their social interaction and their support in person from their friends and family. So now they're isolated and they're struggling with this. A new mode of connecting with people via video as opposed to in person. We're also seeing, people struggling with all sorts of, issues that, sleep disturbances, trouble focusing and concentrating.
To the audience, I have to explain that we almost didn't get on the air because my sleep patterns are a little off, and I overslept. And I looked and I said, "Oh my God, it's 2 minutes to 5!" And I ran down here, and instead of fixing my hair nice, I threw my hat on, and thank goodness you were patient and waited for me, because otherwise we would have blown this opportunity off. But that's what a lot of people are telling me, who I know, is that their sleep patterns. Now, part of it is folks who are not working. I'm working, thank God, but there are a lot of people who aren't working, so they're staying up later. They don't have the routine that they had before. But even people who are working, whether they're working from home or, like in my case, still commuting to the job site, they're saying that their sleep patterns are all out of whack. Is that something that they should not be overly concerned about?
Well, yeah, just to normalize it, I think everybody's experiencing that. And I think certainly, we're all trying to keep up with what's going on in the news. Part of what I work with directly with patients is, asking them to and recommending them to keep a routine, trying to go to sleep at the same time and wake up at the same time, really trying to not, really to limit that media time to daylight hours. As it creeps into the evening, then it really does impact people's sleep. And we see that. I think everybody can attest to that. And so really trying to, maintain some structure to what really feels like a lot of unstructured days and evenings.
Yeah, well, you're the therapist. I'm the newsman, and you're the one that should be saying this, and certainly not me. But I would personally, as a non-therapist, recommend that people limit the amount of time that they listen to people like me and watch people like me, because it could just get really overwhelming, some of these stories. I can tell you that all of us at work, we're struggling to try to find positive stories to put into our shows, just to balance things out a little bit. And I think probably all of society is looking for that. Yesterday there was an indication that there may be some kind of a drug on the horizon to fight the COVID-19, may, and the stock market responded positively to that. And I think that's probably what's happening to us as individuals as well.
Absolutely. I think people are just, you're right. People are just spending a lot of time worried about the future and what's to come, and spending a lot of time trying to gather as much information as they can. And so I do very much recommend for people to limit the time that they're focused on, getting their news and information.
Yeah, Dr. Anisha Patel-Dunn is the Chief Medical Officer of LiveStance Health, and she oversees thousands of clinicians, actually, who are helping people through her program, and who they're just a click away. That's how people reach them. So if I am alone, and I really worry about our seniors who need contact with their children and their grandchildren, what can I do when I don't have that kind of a contact? If I'm a shut-in anyway, to begin with, maybe relatively a shut-in, maybe not completely, but now completely, what can I do to avoid loneliness?
Yeah. So we do worry about our seniors, of course, because they as a group are probably not as technologically forward as everybody else, right? And so, they might be using FaceTime to talk to their children or grandchildren, but I really encourage people to teach them that if they don't know how to, really trying to be creative. That's a population they're used to seeing people and meeting people in person, and trying to introduce them to different outlets on the internet that they can use, trying to get some hobbies on the internet so they're not isolated. And then certainly this is where all of us as a society, we're spending all this time worrying. If we can, help our neighbors, help our elderly neighbors, if you're going to the grocery store, stop and pick up some groceries, things like that. I think that's something that I've seen across the country that's really quite kind.
Yeah, I could tell you, Doctor, from my own experiences when I grew up and worked for many, many years in Detroit, and I got roped in during the day. A friend of mine was involved in Meals for Wheels, and he said, every Thursday you're going to take time off from work and we're going to deliver Meals on Wheels. So I would sneak over there with the news car, and we would have our regular round. We had our regular people. But what I realized was, yes, they appreciated the food, but what they really wanted was the interaction. Mm-hmm. And it wasn't really me. It was my partner who was jumping out of the car, and he was a character. And he would entertain them. He was a bit of an entertainer. And I think that when you do an act of kindness to somebody who's shut in like that, I think it's the act that they appreciate even more so, maybe even than the food that they bring them.
Yeah, certainly. Yes. And I just really, you mentioned what we're doing. I really commend not only my colleagues at LiveStance Health, but across the country in behavioral health, we've converted to our in-office services completely to video, and it is so easy to access So if you're worried about a loved one, an elderly, or yourself even, help is so easily accessible. Just a few clicks away. You can go to our website and schedule an appointment directly.
That's great, and I know all the health insurance companies, if they haven't in the past, they've quickly changed their policies to allow for people to do exactly that.
Yeah, that's very important that you say that. We at LiveStance contract with all commercial payers, and so people can use their insurance to utilize our services, which is a great thing, especially at a time when people are stressed about finances.
I want to ask you about the stress of communal living without being able to get away from your spouse and your children in a second. But first, we have a question from somebody in the audience here on Facebook. How do people understand the fact that social distancing does not mean that there is a vaccine cure, stop the spread, does not stop the existence of the virus? In other words, I think to put this in the mental health perspective, people are hoping that we get some kind of a miracle cure, and it's going to relieve us of all of these pressures and stresses. But really, we have to be prepared, don't we, that a vaccine is not necessarily going to be a panacea.
Yeah, absolutely. I think that, all of us, myself included, I'm hoping for a cure, but the reality is, that's not going to be the case, right? The science shows us. And so, really realizing that as we go back into, leaving shelter in place, if you're in a state where you're, in shelter in place right now, I think we realize that we have to be really cautious. And it's important to, slowly be cautious about that so we aren't ending up back where we were.
So, Dr. Patel, the next question that I keep trying to get to, and I finally will now, is we are seeing, I think, perhaps anecdotally, I'm seeing stories of an uptick of domestic violence. It doesn't necessarily have to get to that point. I talk to people who say, my wife's getting on my nerves, my husband's getting on my nerves. Certainly anybody who's living with somebody, whether they're a roommate, a spouse, a lover, we always need our own space occasionally. And sometimes, especially if people are living in apartments, that's not always possible. What do you recommend that people do when it's getting to the point where we're at the very least gritting our teeth when we look at one another?
Sure. Yeah. So I really encourage people to make sure that they're getting this space in a creative way. So, making sure that you're, scheduling time for yourself, and whether that's going to another room or getting outside for a walk by yourself, just really making sure you're doing something every day, that you're having some separation. I see this with the parents that are struggling with having their children at home, the working parents that have children in grade school or middle school, high school, and now everybody's at home 24/7, all trying to use the same internet, and really different personalities, different temperaments. So really encouraging people to make sure that they're getting their own space. And I think that's where there's some creativity. I have also found when I've been trying to do sessions with people and them wanting to make sure that they're in a quiet place and they're worried about somebody overhearing what the conversation is about. And so really, encouraging people to, take some time away from one another. I think it's very important.
I have a question coming in from my friend Lionel, who is joining us, I believe, in Georgia. How do you help family members who have been called to go back to work but are apprehensive about doing so? And I got to tell you, that's a great question for me, exactly, because I go into work every day, and I'm going to Manhattan. So everybody hears, New York City, it's the epicenter, it's horrible, and I'm almost like a leper. They don't want to have anything to do with me. But it's not quite like that. But they are really worried about me. And in my case, I actually have to explain to them how it's beneficial for me to do this, the way I'm operating my life, and I won't get into my own personal details right now. But how do you allay the fears of your family members if and when you are called back to work?
Yeah, so I think really, going back to the facts of, we can take precautions as we go back to work, wearing our cloth face coverings, washing our hands, really keeping our distance from our coworkers at the office. Just really important to recognize that we're as people are going back to work, we're in a different state than we were, say, in February when we had no idea, what are some ways to avoid getting sick. And also just to normalize that everybody's having this feeling, right? And so even if, when I'm going to the grocery store, I'm being cautious. I have to go to the grocery store to get groceries for my family, but being cautious about that. And so, trying to really remember that we're going back slowly.
I have to tell you, I'm a Detroit boy, and I cut my teeth in this business, being live on the streets of Detroit, covering blood and guts. If it led, it bled. If it bled, it led. The newscasts, and it was almost like being, because of the neighborhoods I went into, being in a war zone sometimes, actually. Very, very dangerous. And I have to tell you, I was never so much concerned about my own well-being working all those years on this mean streets of Detroit as I am going to the grocery store. And what's really weird about this, and I'm sure we've all experienced it, after 9/11, people were like almost embracing one another, if not physically. When we saw one another, there was kind of a look between us. Hey, buddy, we're in this together. Today, when you're pushing that cart in the grocery store, people look at you like you're a predator. Oh, I hope that one doesn't get too close to me, myself included. It creates a whole new dynamic about interactions between neighbors.
Yes, absolutely. I think people are worried. And you bring up a good point. We've been working and trying to prioritize seeing our frontline workers, first responders. And I can't tell you, physicians that are on their way to work, maybe stopping into the grocery store in their scrubs, and talk about people staying away. And I think it's actually really sad, because here we are trying to really commend our frontline workers, and then people are really trying to stay away. That look and that energy comes across. And so I do think that's coming across regardless for everybody. And so how do we manage that and really be kind to one another?
Yeah, I would recommend, again, I'm stepping into your field a little bit, but I would recommend that when you see somebody in scrubs at the grocery store, walk up 7 feet, 8 feet away from that individual and thank them for what they're doing for us, because they're putting their lives on the line for you and me. We should not be shunning them. We should be thanking them. So it's going to be a new world. People talk about going back to normal. We are not going back to normal. Let's be honest about it. Even as some of the states are opening up incrementally, even if it turns out like the Georgia experiment turns out to be a terrific experiment, that Governor Kemp was a genius, not an idiot. People say one or the other when it comes to him. And I guess the people in Georgia are going to be the guinea pigs in the experiment there. And I hope it turns out that he's a genius. We're not going to be shaking hands. We're not going to be hugging people. We're not going to be crowding into stadiums, not at least immediately. We're going to have to adjust to that once we get out of the house. There's going to be all kinds of adjustments, I think. But I want to ask you specifically about your field of work. I have a friend who's a psychiatrist, and it's really interesting because just before this pandemic broke out, I just happened to ask her coincidentally, do you ever do therapy, on the internet? She says, I don't think it was your company. It might have been. I don't remember the name of the company, but she was being recruited to do exactly that for a company. And she had been resisting it. She says, I need to be able to see people face to face. I need that kind of interaction. I need to get that vibe from them. I would never go into, and then now we check in with one another. She says, I never realized how good this is. And of course, we're forced into it now. It seems to be working. it's a little bit different. There are different tells when you're talking to your patient than we had before, but there are tells, and it can be done. So my question to you, Dr. Anisha Patel-Dunn, is this. When we go back to whatever the new normal is, do you see therapists continuing to do a significant number of their work over the internet as opposed to face-to-face?
Mm-hmm. Yes, I do. I think we are just at the beginning of a huge paradigm shift in healthcare and medicine. And, this has propelled us years ahead for utilizing telepsychiatry, teletherapy, telemedicine. And I anticipate, as, I myself have been doing telepsychiatry for 5 years, that once people do it, once patients utilize it, they love it, right? They want to, it's so easy. They're not stuck in traffic getting to their appointment. They're not stuck at home with a, sick kid, and so they have to cancel. It's so easy to keep the care going. So it's actually, in a lot of ways, it can be even better. I do envision sort of this hybrid model where both from the clinician side and from patients, that people will perhaps, clinically there's an indication to be seen in the office. And then there are some people that just, for whatever reason, are going to want to be seen in the office. And then I think from the clinician side, the comfort and the ease of working from your home is amazing for your sort of own mental sanity as a clinician, right? And your work-life balance. So I think we're going to see a huge shift, especially as, over the next coming months and years to come, but certainly in the coming months, of people really trying to do both, which is great.
Look at you and me. You're a terrific interview. I always like to do my interviews face to face. I would meet people before going to work and stick a microphone in their face. I would never be able to interview you, and this is a delightful interview. You're in San Francisco. I'm in New York. This couldn't have happened if we didn't do it this way. So it works for me as well. I've been thinking about the future, and I think that my number one tool in the future is not going to be it actually had morphed into this. I was doing all my interviews. Where's your tape recorder? Right here. I pulled this out and I would interview people. It's that really changed things in my business, in the radio business, the iPhone. But I think this is changing as well. Tools like the one we're using now. We could schedule an interview. It's at a convenient time for you. It's at a convenient time for me. And boom, here we are, face to face, and I think it's great. It feels almost like we're really in the same room together. It's terrific.
Yeah, no, it's great, and I think something that people aren't realizing as well is care is so easily accessible, and it's decreased stigma really too. Of everybody's experiencing these symptoms, but then it's so easy to access care. That people can just get online, book an appointment, and have a video appointment. They don't have to leave, go into an office. So I think really, my goal is access to care and making sure people are getting the care they need.
Right. And also in your business, there is a bit of a stigma, unfortunately, in society. People don't like to admit they're going to a therapist, and maybe they don't want to be seen walking in and out of Dr. Anisha Patel-Dunn's office, by their neighbor. Oh, Gary, he's seeing a shrink. He must be crazy. And which, of course, which may or may not be true, but of course does not necessarily mean that I am if I'm coming to see you. So maybe there's, and also people in rural areas now might now say this is the norm. There's no therapist near where I live. Now I can reach out to a preeminent therapist like you in San Francisco from my little farm in Kansas or something like that.
Absolutely.
Yeah, very, very cool. I appreciate you doing this. I know you're probably nervous that I wouldn't show up because I was sleeping right to 5 o'clock, man. I ran down here and turned on the computer and boom. But it turned out to be a great interview. I appreciate it. For those of you who are watching on Facebook, I'm now going to slide over to paltalk.com to continue the conversation. That's a free download. Go to the Paltalk Global Newsroom, and I will be holding court there. And as I always say at the end of these conversations, please stay safe and peace out.
Thank you.